Hello, everyone. I'm Jeannie Northrup with Pharmaceutical Executive. I want to welcome you to today's webcast, From Search Terms to Smarter Prompts, the new era of healthcare SEO, sponsored today by LiveWorld. We are so appreciative of you joining us today, and we are appreciative of LiveWorld sponsoring today's program. LiveWorld is a human-led AI-powered agency and software company providing intelligent systems, marketing, and moderation services that unlock the full potential of social and digital media to transform customer relationships through integrated compliance, engagement, and insight solutions. Today's program is designed to be interactive, and so we encourage you to ask questions to our subject matter experts throughout the presentation. They are here and they are eager to help identify any questions you have and help respond and connect with you. You can submit any questions you have by typing them in the Q&A box. That box can be found at the bottom of the video player. And we look forward to responding to your questions as time allows at the conclusion of today's event. For viewing purposes, you can enlarge the slide window by clicking on the small icon that you should see located in the bottom right corner of the media player. Please note that all slides will advance automatically throughout today's event. If by any chance you experience any technical problems viewing or hearing today's presentation, please click on the question mark help widget in the top right of your presentation window. It's now my pleasure to welcome today's subject matter experts. Our first speaker, Victoria Houston, Senior Digital Marketing Manager at LiveWorld, joins us. Victoria, she's a senior digital marketing leader with expertise in AI-driven strategy, website digital management, paid advertising, cross-functional collaboration. She has a great reputation for being known for connecting teams, optimizing campaigns, and turning digital insights into practical growth. Victoria, welcome. And then also joining Victoria is Mark Traphagen, VP of Product Marketing and Training at SEO Clarity. A former teacher and salesperson, Mark is a sought-after speaker. He's known to make presentations at major conferences. He's a regular contributor. He specializes in translating complex search data into actionable growth strategies for Fortune 500 brands. So, Mark, it is such a pleasure to have you join today's program as well. So welcome again to both of you. Welcome to our entire audience. Again, your participation today. We look forward to it, the Q&A at the end. At this time, I'm going to extend the floor to our presenters and ask you to go ahead. Feel free to begin your presentation.
Yes, thank you for the introduction. So at a high level, this is really about how LiveWorld brings together human expertise and AI-powered tools to help teams work smarter. We're not replacing the human side of the work. We're simply strengthening it with technology that helps teams move faster, make better decisions. Specifically on the compliance side, we help brands stay proactive so they can run digital and social programs with more confidence, less friction. The goal is to build compliance into the process earlier so teams can scale without slowing down. For engagement, we focus on creating meaningful interactions that help build relationships, influence behavior. It's really about being responsive, relevant, consistent in the moments that really matter. For insights, we turn engagement into actionable intelligence. So that means helping teams see patterns, understand what's happening, and use those insights to drive smarter decisions. The real message here is balance. So how can AI give us speed and scale, and we join and partner with it to create human oversight that ensures quality, judgment, and trust? So together that creates a more effective operating model for brands. AI and GEO are about much more than visibility. In healthcare, it's not enough for a brand to simply show up in search. What really matters is whether the information being surfaced is accurate, trusted, and actually useful to the audience. As search becomes more conversational, AI is playing a bigger role in deciding what people see first and how that information is framed. So that means healthcare teams need to think beyond rankings and start focusing on how their content is interpreted, reused, and acted on in the AI search experience. For regulated brands, that becomes even more important. If the information is incomplete, unclear, out of sync, the risk is not just lost visibility, it can also create clinical, regulatory, or reputational concerns. So the real goal here is trusted visibility, making sure the right content is not only discoverable, but also understood correctly and presented in a way that supports the brand and the audience. Traditional SEO has focused on rankings, traffic, CTR, and backlinks, while AI search introduces a different set of priorities. So we see specifically visibility, citations, and shares of answers. In SEO, the main question is, how does my page perform in search results? Whereas in AI search, the bigger question becomes, how often is my brand referenced in responses? So that means that the unit of value is changing from page level performance to answer level presence. The tools are also changing. Teams now need prompt tracking, citation analysis, and query analysis to really understand AI visibility. This does not mean, of course, that SEO is obsolete in any way. It just means that SEO is becoming the foundation for AI visibility. But the measurement and optimization layer is expanding. The key shift to emphasize is this: brands must move from ranking pages to being included in answers. Instead of thinking only about traditional SEO, we want to think about how content shows up in conversational AI and in the answers people are actually getting. That matters even more in healthcare, where trust and accuracy are critical. The first goal is to move from keyword-based search to more natural conversational prompts. People aren't just typing short phrases anymore, they're asking full questions, and AI tools are responding. Second, we want to understand how AI overviews affect visibility. It's no longer just about ranking on a results page. It's actually about showing up in the summary or answer that the user sees first. Trusted healthcare content has to do more than just exist. It needs to clearly signal credibility, expertise, relevance, so that AI systems are more likely to surface it. And finally, we need to measure what matters. That means looking at citations, referrals, and whether your content is actually being used as a source in AI-generated answers. These objectives give us a practical roadmap: understand the new search behavior, improve visibility in AI responses, and strengthen trust signals, and track whether it's working. Before we talk about what brands should do next, it's important to understand why the shift is so significant. The reason this matters is pretty simple. Search is no longer just a traffic channel. AI is changing how patients encounter health information, and that means the first answer they see may be synthesized rather than directly clicked through. Healthcare brands have to make sure their content still performs in that environment. It has to be clear enough for people, structured enough for machines, and trustworthy enough to be surfaced in an AI response. So what changed in search? This shift in how people search is already showing up in behavior change. People are not just typing shorter terms anymore. They're asking fuller questions that sound more like a conversation with a clinician or a care guide. That creates a more complex search journey because the user is often trying to understand a symptom, evaluate options, and decide what to do next. In healthcare, that makes prompt style content especially important because it has to address the question behind the query, not just the keyword itself. In traditional search, someone might type something like you see here: knee pain specialist or headache doctor. But if you're typing with an AI search, people are asking questions the way they actually speak, like, what doctor should I see for knee pain? Or what could be causing frequent headaches? That change matters because it reflects how patients are now searching for care. They're not just looking for a service line or a specialty, they're asking for guidance, next steps, recommendations. The takeaway is that our content needs to match that behavior. We need to think less about short keyword phrases and more about the kinds of questions people are likely to ask in a conversation with AI. So instead of optimizing only for a term like back pain treatment, we should also be ready for prompts like, what is the best next step for ongoing back pain? That's the kind of phrasing AI systems are built to understand and respond to. For example, something like a GLP-1 weight loss medication, the same idea applies. The search may start broad, but the real user intent is often much more specific and conversational, like asking what type of doctor to see or what treatment path makes sense. So if we want to show up in AI-driven search, we need to write for how people ask, not just for how they used to type. Next up, Mark is going to delve into the core challenges within prompt chaos.
Yeah, thank you, Tori. Great summary there and great introduction. Bringing in, because those behavior changes are sea changes. As Tori so well said, people are going from learning, they're using these AI engines because they know that they can put in however much complexity they want. They can put in every little nuance and thing of their symptoms or whatever they're looking for. And the AI will go out and do all the searches, do all the research, and come back with a comprehensive report. But on the reporting side, or on the side of where we need to measure our performance in AI, this creates some real challenges. There's first what we call the manual bottleneck, which is if you're trying to do this on your own, trying to get do all that research, because it now, as Tori said, it goes so much deeper than just the good old-fashioned keyword research. You're having to delve into intents and all kinds of nuances and all the ways that the AI might surface, which are black box to us. The AIs don't give us any of that. They don't report any of that to us. And then there's what we call the synthetic gap. There's some point solutions out there that say, oh yeah, we'll give you the prompts to track, but they're basically using the equivalent of ChatGPT to make those up. There's nothing behind, there's no substance behind them. So that takes us to the next point, which is that fundamental to discovering the content that you need to create or optimize for AI search is knowing how the AI engines perceive your brand and content at present. So this means, like we said, having the right set of prompts to track. But finding those would take you a lot of time-consuming research. That's that manual breakdown, that manual block that we said. So at SEO Clarity, where I represent, our ArcAI platform dedicated to AI prompts has come up with a solution that does all the heavy lifting for you. So you're looking at the results out of what we call prompt research in ArcAI. And as I said, does all the heavy lifting. It's actually going in the background and researching your brand, your domain, your competitors, your marketplace to suggest highly relevant topics and prompts to track an AI search. And as you can see here, it gives you a breakdown of those by topic. It tells you our estimated volume, how much are people actually looking for that, so you can make the intelligent decisions about which prompts are most important to track, and even breaking it down by the stages of the buyer journey, brand versus non-branded prompts, which each have their own use case, and they're branded. You're typically looking for what is the AI saying about our brand to potential clients out there. Non-branded, you're looking for, are we the source of information when people are doing their early research? Click the boxes, the ones you want to use, one more click, and you start tracking those in ArcAI. So the next thing to move on to now is really getting at deeper understanding of what the AI is after, what it's looking for, and Tori's going to share that with you.
Yes, thank you. And ArcAI prompt research tool is just so helpful in so many ways, especially in understanding how AI search surfaces content. And the next question naturally, of course, becomes what actually makes content authoritative enough to show up? I think as we see, it starts with clear, easy to read content. AI systems tend to favor content that's straightforward, well organized, written in language real people actually use when searching for answers. If your content, I think, feels overly technical, promotional, or difficult to scan, it's less likely to perform well. Second is strong trust and authority signals. So this includes things like expert authorship, credible sources, citations, brand reputations, signals that show your content can actually be trusted, which is especially critical in healthcare and pharma. And also having machine readable structure. So AI tools need to easily interpret your content. So things like clear headings, schema markup, FAQs, structured formatting, they help systems understand what your page is all about and then pull the relevant answers from it. Especially in healthcare, it's providing accurate, plain language explanations. So patients and consumers are asking increasingly complex health questions in very conversational ways, and brands that can answer clearly, accurately, and accessibly are in a much better position to appear in AI-generated answers. At the end of the day, authority today isn't just about ranking on Google. It's about creating content that both humans and AI systems can easily trust, understand, surface. That change in user behavior naturally leads to a broader shift in how we think about search optimization today. This is not an either or shift. SEO still matters a great deal, but the goal is broader now. It's not just about ranking a page, it's about making the page understandable, trustworthy, useful. That means that traditional SEO fundamentals are still important, but they now sit in a larger AI visibility strategy. What we're seeing today is that search behavior isn't happening in one place anymore. It's fragmented across traditional search engines. So AI generated answers, social platforms, community discussions, trusted medical and industry sources. For pharmaceutical brands, that creates a much bigger visibility challenge because it's no longer just about rankings, but it's about being consistently present wherever decisions and perceptions are forming. That's why SEO, GEO, and AIO need to work together as a connected system rather than separate tactics. In a regulated environment like pharma, it requires a human-led, AI-enabled approach to ensure accuracy, compliance, and trust across all these channels. What we're really seeing now is that visibility is no longer happening in a single channel or even a single journey. It's spread across traditional search engines, AI-generated answers, social platforms, third-party sources. For pharma brands, that fundamentally changes the challenge. It's no longer about ranking well, but being where people, of course, are forming opinions. That's why SEO, GEO, and AIO can't operate as separate functions anymore. They need to work together as one integrated system. And in pharma specifically, that system has to be human-led and AI-enabled. So you get scale and efficiency without losing accuracy, compliance, or trust. So building on that, it also changes how we think about the channels themselves. We can't look at owned, paid, and non-owned as separate silos anymore. So owned channels like brand sites and disease education hubs are where we maintain control. They're structured, compliant, and foundational for both search and AI understanding. Paid media still plays an important role, but more as an amplification layer that supports visibility across intent-driven moments rather than working in isolation. And then there are the non-owned environments, places like Reddit, social platforms, Wikipedia, forums, where a lot of perception is actually shaped. These aren't controlled channels, which is why they require ongoing monitoring, moderation, influence management to understand what's being said and how it's spreading. So the shift here is that visibility isn't something you publish once in one place. It's something that's distributed, interpreted, and reinforced across multiple ecosystems. So both human-driven and AI-driven, and it requires all of these elements working together to manage it effectively. Mark, I think you would agree that there's a crisis of inaccuracies.
Oh boy, is there, Tori, you said it. In fact, this is kind of not to sound too clickbaity, but we did a research on this across our enterprise clients, and what we found literally shocked us. As you see here, we found out that 40% of the time, 40% of the individual responses AI made about enterprise level brands contain significant inaccuracies. It means almost half the time people aren't getting things, the right picture from the AI. Now, why does that happen? There's a couple different reasons. A lot of us have heard about the what we call hallucinations in AI. That the AI is kind of programmed to come up with an answer no matter what. And if it doesn't know for sure, sometimes it'll just make an answer up. We call that a hallucination. But increasingly, what we're seeing is that many of these inaccuracies come because the AI is somewhat source agnostic. It doesn't have all the experience that, say, Google has in terms of vetting sources and finding the most trustworthy and reliable sources. So it can get information from anywhere, and that a lot of that information can be outdated or inaccurate. In fact, we found that in a single AI summary can make as many as 20 to 40 individual claims about a healthcare brand. In healthcare, it's more than any other segment that we looked at. So that's a lot of opportunities for it to get things wrong. And when it gets things wrong, what happens is what we call the psychological gospel effect. Patients tend to treat AI summaries as gospel, as objective facts, as the expert. They rarely click through to verify the things that they're seeing. So if the AI says you don't provide this service or it costs something different than what, way more than you actually charge for it, any kind of thing like that, you've lost that patient. You've lost that potential client or customer before it even happens. Let's take a moment to dig down into the specifics of this because we have a capability in SEO Clarity's ArcAI platform called accuracy. Our names are very transparent: visibility, accuracy, things like that. But accuracy, we've developed this because we realize it may be actually a more critical problem than even visibility. It's fundamental. We want to be visible in AI search, but the AI search is saying a lot of inaccurate things about us. It may be better if we were invisible. So we identify in RKI accuracy 4 kinds of conflicts, and you should be looking for these as you look at your own results. The first and most obvious is a direct conflict. This is where the information the AI is giving out completely does not match your source of truth, your own site, what you say about yourself. So simple example of this is the AI says that one of your clinics is closed when it's actually open. We've had this happen for actual clients, like lost business because somebody went in and say, is there a clinic near me? And the AI says, oh, that's permanently closed. And that may be, some old news item out there that it was closed down for rehab, restructuring or rebuilding or something like that, and it's now open. But there can also be things like quantitative mismatches. This is where it gets a number or a quantity or a date or something like that wrong, like wrong dosage info, pricing, or years of experience that you have. Then there can be missing qualifiers where the AI omits a critical nuance. So something like it leaves out prior authorization required. So the person thinks like, oh, anybody can do this. I can get this. And they go to the site and then they see that qualification and it turns out to be a negative for them because they weren't expecting it. And then finally, what we call insufficient evidence. And this is where this gets closer to the hallucination side, where the AI just makes some unsupported claim. And that usually happens because your site doesn't have a clear source of truth on that. Now, what ArcAI accuracy does, it not only flags all these and shows you when they happen, but it helps you track down the source of each so you can do outreach or whatever you need to do to say, hey, your site has this inaccuracy, you need to update this information. But in that insufficient evidence side, it can help you identify gaps where, oh my gosh, we don't really talk about that. We don't have clear information. We should include that so the AI can get it better. So important that you be thinking about this going forward in terms of these are things that you should be concerned about in addition to just visibility. So Tori, what do we come to now? What should be our strategy in the healthcare field going forward?
Yeah, I think healthcare content should not live in silos, like we mentioned prior, but it should be built as a connected system to help patients move from understanding a condition to actually taking action. So that could mean, supporting service pages with educational content, insurance information, next step resources. The more depth I think the site has around a topic, the easier it is for both users and AI to understand the brand's expertise. That's really the foundation, building connected, comprehensive content ecosystems instead of isolated pages. But creating better content is only half the equation. The next question I think a lot of people are asking is, how do we know it's actually working? I think with traditional SEO metrics like rankings and clicks, those all still matter, but they don't tell the full story in an AI-driven search environment. As discovery becomes more fragmented across search engines, AI platforms, answer engines, brands need new ways to measure visibility, authority, performance. So that kind of shifts from what to build to the measurement that actually matters. The measurement conversation also has to evolve. Rankings are still useful, but they don't tell the full story anymore. Brands need to know whether they're being cited, whether AI is sending meaningful traffic, and whether the way they appear in answers is accurate. In other words, we need to measure both visibility and the quality of visibility. What changes most in this shift is how we measure success. Traditional SEO has always been very clear: rankings, traffic, CTR, backlinks. Those type of signals still matter, but they don't tell the full story. So with AI-driven search, we also need to understand whether the brand is actually showing up in generated answers, not just on a results page. That means tracking AI citations, referral traffic coming from AI surfaces, and overall branded visibility. It also requires paying attention to engagement and how often the brand is being surfaced in those responses, not just indexed. The key point is that we can't really rely on rankings alone anymore. Success is now about measuring both exposure and accuracy across AI-driven discovery, because being present incorrectly is just as risky as not being present at all. I think that takes us to what we typically see for next steps for our current clients is for organizations kind of just getting started. It begins with understanding where you stand today, helping clients audit their current visibility across traditional search, emerging AI platforms, and then identifying content gaps, benchmarking against competitors. We typically approach this in phases so brands can build a clear foundation before scaling. So it starts with an audit and an AI benchmark report. That gives us a baseline of where the brand currently appears across search, AI generated answers, and then any kind of digital ecosystem. So we understand visibility, gaps, competitive positioning. And from there, we move into optimization. So that's where we refine existing content to improve both traditional SEO performance and AI discoverability, making sure content is structured, clear, and more likely to be referenced or surfaced in AI responses. Once that foundation is in place, we expand into a broader content strategy that goes beyond just owned properties. That includes how the brands show up on third-party platforms, social environments, other non-owned spaces where influence is actually forming. Throughout all of this, we're continuously improving KPIs, shifting from just rankings and traffic to include visibility, citations, accuracy in AI outputs, and engagement quality across those channels. The brands that move fastest here are going to have a real advantage. This shift in search is happening quickly, but it also creates a huge opportunity for brands that are willing to adapt early. We need to shift from terms to prompts. Traditional SEO has focused heavily on short keywords and exact match terms, but consumers are now searching in full questions and conversations, especially in healthcare, where there's nuanced questions about symptoms, treatments, costs, next steps. Brands need content built around real patient prompts, not just keyword lists. Secondly, we also need to shift from rankings to visibility. Being number one on Google is not the only goal. Brands now need visibility across Google AI overviews, ChatGPT, Perplexity, voice assistants, other discovery platforms. The question becomes, are you showing up where people are searching for answers? And third, we need to shift from clicks to trusted discovery. In many cases, users get answers without ever clicking through to a website. That means your brand still needs to be present in those moments of discovery, building trust, credibility, influence, even when the traditional click model changes. The brands that recognize these shifts early and evolve their content strategy are going to be the ones that win in this next era of search. We've got a lot of really good questions that were coming in, so I think this would be a great time for Mark and I to answer some of those. So you can reach out using the link provided in the webinar chat, but I think this would be great to kind of start our conversation off.
Looking forward to your questions.
Totally. Wow. Yes. Great presentation. As someone who has led a career in content herself, I feel like I've learned a lot today, and I will definitely be actually asking some of my colleagues to watch this presentation on demand. Great point. Victoria, thank you. And Mark, 40% inaccuracy. Wow.
Yeah.
Like
and
I've heard,
sometimes it's more, that's average. So sometimes it's worse.
You hear about it and you're like, okay, I get it. But that number really, that's kind of shocking that it's that inaccurate. So not even just as a content person who is helping support her brand, but as a patient, right? Looking up everything using AI. So really great points. Yes, we are going to jump right into our Q&A. I have a ton of questions already in the queue. So I hope you guys drank your coffee. We are going to get ready to get started. And again, to anyone who hasn't submitted a question, we're not out of time. Feel free to continue submitting any questions you have through the Q&A box. And if we do run short on time today, don't let that discourage you. Victoria and Mark will also be reviewing, fielding, answering your questions following today's live broadcast. That said, let's jump right in here. Victoria, I'm going to start with you. How do AI overviews and AI generated answers decide which sources to trust and synthesize? I was kind of wondering that while we were exploring.
Yeah, that's a really great question. I think AI overviews are pulling from a wide mix of content across the web, but they're not treating every source equally. They tend to favor content that's clearly structured, topically relevant, and supported by signals of authority and consistency. So in healthcare, that means brands need to think about whether their content is easy for machines to read and easy for users to understand, but also credible enough to be surfaced as a part of a synthesized answer. So I think the better the content is organized and reinforced across your site and the web in general, the more likely it is to influence what AI chooses to trust.
Thank you. And I thought some of the points you made up about just creating pages with that type of look and feel. It made me almost think, should we be re-exploring how web pages are even built? Definitely some great points.
Totally. Could I just add something? Totally agree.
Absolutely. Go ahead.
100% agree with Victoria on all of those recommendations. Those are fundamental. One distinguishing that might be useful to people they ask specifically about AI overviews is to remember AI overviews are built into Google search itself. And so there tends to be a lot more influence from Google search there than in some of the third-party engines such as ChatGPT or Claude or Perplexity, those. So in all of those, having a good search ranking for your content can matter, can make a difference, but it's profoundly more important for AI overviews if that's where you're concentrated.
Okay. So Mark, question here, source of truth. What does that actually look like for a healthcare site, and how should one structure content so AI treats it as authoritative?
So I mentioned source of truth in relation to our accuracy product in ArcAI, SEO Clarity ArcAI. That's a specific term for us in terms of a very dedicated scan that we do of the client site and ongoingly update to determine what's all the factual information that we need to compare to see if the AI is lying about or making up something up or being inaccurate about facts about the brand. But overall, your goal should be to be a source of truth for the AI. So the kinds of optimizations that we talked about, the things that Tori just reiterated in her last answer, are critically important because those are things that are going to get you more influence over the AI. It's important to remember when AI uses search and it finds a page on your site and decides that page is useful, it not only gives you a citation, which is nice because that's where any traffic is going to come from, but your page is also influencing the answer that the AI ultimately serves up to the person who asked the question. So, you know, very important. That's the way that you influence things. That's where you become part of it being more accurate, the answer being more oriented toward what you think is important, things that matter from you to that. So, you know, all those are a way of being influenced. And then just overall having the kind of good quality, easily to understand, readable content that we've talked about ultimately influences the models. Just bring up quickly, one significant shift that we've seen in the past year is as these non-Google engines, again, ChatGPT, Perplexity, Claude, even Gemini, are moving more toward trying to be search engines or AI search engines. They are now indexing content. So when they visit a page, they're not just using that page to train their general language model, but we see more and more that they're remembering the information from there in a sense. They're indexing it so that they can use that information going forward. So again, great pages on your content. The more complete your content is, the more influence you have over being that source of truth for the AI engines.
Victoria, clinical, regulatory, reputational risks. Where do you see them most often enter when AI summarizes a pharma brand?
Yeah, and I get this question a lot from clients. So the risk that I see usually enters when there's a gap between what's been approved and then what's publicly visible online. So usually that can happen when older content's indexed or when supporting pages are maybe inconsistent with core claims. Maybe AI pulls together information from multiple places and blends it in a way that changes the meaning. So in healthcare, even a small shift in wording can create a big issue if it oversimplifies maybe like a safety message or leaves out important context or maybe makes a claim sound broader than it really is. So the challenge is not just accuracy on the page, but consistency across the entire content ecosystem. So that takes a little bit more of like an undertaking and understanding.
All right, I'm going to jump to another question here, and I'd like to ask Victoria, I'm sure you'll have some insight here. Mark, you might as well. When it comes to this owned content, then specifically, website structure we know is important, but not owned by the content creators. Who do you suggest all needs to collaborate together and be involved to ensure that optimizations are actually working, especially for some of our larger enterprises? Any insight, ideas? Who would be in your top team there?
I mean, obviously subject matter experts. One thing that we preach regularly at SEO Clarity, even though we have tools that can help with AI assistance with creating your content and structuring that content well for AI, making sure that your topic gaps are covered, all of those things. We specifically build those to be assistants, but we emphasize to our clients, human in the loop is so important. So having a subject matter expert involved, being the absolute vet of final vet of the content that goes out, make sure it represents your brand well, represents your tone of voice, your content guidelines, all of those things are involved. And I'll just add that we saw back a couple months ago, Google beginning to crack down heavily on what we call AI slop, content that was just obviously fed to ChatGPT, published as it was, with no review, no adding of personality to it, no adding of your personal expertise. So that's critically important. So that would be mine. Would be make sure your subject matter expert is involved. Tori, you have more to add to that?
Yeah, I would agree with that as well. And I think understanding that on the non-known environments, like a Reddit or a social platform or Wikipedia, it requires ongoing monitoring or moderation and even influence management to understand, what's being said and how it's spreading. And so the key shift is understanding that when content's distributed or interpreted in a certain way, both human-driven and AI-driven elements are required to manage it effectively. So we do need those subject matter experts. We do need moderated content on these both non-owned and owned environments.
Thank you. So the next question I have here then, Mark, I want to throw you back on the spot and ask about some of these missing qualifiers we spoke about. Prior authorization required, consult your physician. How do these get stripped out, and what can content teams do to make them stickier?
Oh, that's such a great question. They get stripped out because we have to remember, without getting too deeply technical here, what AI really is. We call it artificial intelligence. It's certainly artificial. It's not really intelligent. It's a highly complex math problem being solved. It's looking at, putting together, turning words and phrases, we call them tokens, into numbers that have a relationship to each other. And then when you type in a prompt, something you're looking for, all the engine is doing a mathematical, very complex mathematical formula to figure out what are the most likely words that would come out of that prompt. And so it's not smart, it's not intelligent, it doesn't recognize that this qualifier might be important on there. So it's just going to grab the quick answer that it sees. For things like that, for the missing qualifiers, first of all, make sure they're explicit in your content. We find in a lot of cases where that happens, the recommendation, we go to the client's page and we say, like, well, you actually don't even mention that, or it's not explicit, it's not really clear, make it clear. And then second, very important, put it right in the answer, put it right there. Don't have it somewhere else or after several other paragraphs of information or something like that. So put it as close to the main answer as you can. All the important facts, all the qualifiers, things. The AI will more likely pick up what is closely associated together than things that are disparate on the page.
Thank you. And this next question, I probably should have started with this one, but Victoria, what are the most common ways that you see AIs answering or misstating or oversimplifying claims?
Yeah, I think a lot of the time it comes down to fragmentation. So if the approved message is spread across different pages or maybe written in overly technical language, buried in dense content even, AI may not pick up the full nuance of the topic. It may lift a simplified version from maybe a more visible source or combine multiple references into one answer that sounds clear but loses important caveats. That's especially risky in pharma, where approved language often depends on precision and context and qualifying detail. So if the source content is not structured for clarity, AI may flatten that nuance in the final answer.
I feel like that topic could be a whole separate webcast. I feel like this is something that yourself, Mark, and I could probably speak about for a full hour, right?
For sure.
Mark, I love this one. I feel like this is the message to everyone that joined us today, as well as the message to ask everyone to share with their colleagues when the on-demand version of this webcast is ready for replay. What is the biggest misconception healthcare brands have about their AI visibility right now?
Oh, hmm.
Putting you
I
in the
would
hot
say,
seat here for sure.
I would say not knowing it, because tracking it can seem so intimidating, right? Like, how do you track it? How do you know you're tracking the right things? With, in the SEO world, most of us have like years or decades of experience in doing what's called keyword research, right? And there's a lot of very well-established techniques for that, for finding out the main root words, the main root terms that people search for around your business, and then you track those. That's pretty straightforward, pretty simple. In the AI world, it's all a lot messier because, as we've been saying, it's generative AI, which means it's making up an answer every time a question is asked. Even if you ask the same question, two different people ask the same question, they're going to get a slightly different answer. So how do you measure that? I think you have to have ultimately a process and a tool that will help you to establish that. I'm going to say, of course, that SEO Clarity Arc AI has that. We have a prompt research tool that is like none other in the business, and we previewed a little bit in the webinar. That helps you get down to the prompts that are truly going to be useful, that actually are being asked about in AI. And we have a lot of guidelines for that. I'm going to give a quick guideline for people that don't have access. That's just when you're planning the prompts to measure and track your AI. There's three little things I say are most important. One is for any topic that you're looking to track. First of all, each prompt should be about one entity, one main thing. So one drug, one research practice, whatever it is, one thing. Then you can add aspects to that, have different versions of it. An aspect would be one qualifier. So, not just information about this certain drug, but is the drug effective for this condition, effective for that condition? And then add words that the only other wording you need to add to the prompt that you're tracking is anything that shows intent. So wording that would be more about looking for information, right, would be different from looking to purchase something. Don't worry about the exact wording. The AI is good at figuring that out, imagining that. So follow those three simple things, for constructing the prompts that you're going to track. That's the first step toward really having accurate visibility. One more quick thing to say about that. Remember that mindset shift that we're going from, whereas in traditional SEO, traditional search engine optimization, we're looking at, a set of keywords and do we rank and where do we rank for those? That was the main thing. In AI search, it's a whole different world in terms of your question that you want to answer is, given a topic and given any aspect of that topic, what is the probability that my brand will be visible, will show up for that? We say probability because you're not going to show up every single time in most cases. So what you want to know is, like, most of the time, do we show up for that? So you want to look at your results over time, measure that, and that gives you an idea of where your strengths and weaknesses are.
Thank you. Some really great guidance there. All right. Content, SEO, technical signals. How can they improve the accuracy of AI generated answers then, Victoria?
Yeah, the strongest signals are, the ones that make content easier to understand or verify, and that connect to the right entity or topic. So that includes a clear page structure, strong headings, concise answer sections, FAQ style content, schema markup, supporting content that then builds topical depth. It also includes traditional trust signals like authoritative, readable content, consistent terminology, technically sound pages that are easy to crawl and interpret. In healthcare, I think accuracy improves when the content's both human readable and also machine readable, because AI is much more likely to surface what it can clearly parse and confidently trust. So I think the overall takeaway is that AI visibility is no longer just about being present in the search results, but also about shaping the quality of the answer itself.
Thank you. One thing I'm just thinking about from some of what Mark was just advising on is just like, all right, this is somewhat new, right? It can be a bit intimidating determining how to measure your success right now compared to what we know in decades of understanding SEO. And it makes you wonder, like, where would this conversation head in a year from now after we've learned a bit more and seen things to continue to evolve, because they're evolving so quickly. Great points. Mark, I want to wrap up today's discussion. One more question specifically aimed for you, although Victoria, feel free if you have anything to help pitch in here. How should brands think about the gap between traditional SEO success, those clicks, and the AI visibility success, what we're talking about now for accurate representation without the clicks?
Boy, great question. Yeah, great one to end on. I think one thing I want to say about that, kind of piggybacking off what Victoria just shared, is that there's a lot of overlap between SEO and AEO. You're not totally, well, we've been emphasizing the differences and some of the mindsets and philosophical differences you have to approach it with. At the core level, a lot is the same. A lot that you've learned for traditional search, traditional SEO applies. A lot of the things that we've been recommending here are also good recommendations for regular search. I mean, Google has been applying AI to search for years now in different and varying ways, machine learning, all of these kind of things. So these recommendations have really not that new. But I think in terms of going forward, other things you want to look at, the main considerations, mind shift. We talked about that mind shift again. I think that probability thing is very important. And the one last thing I would say is one of the biggest shifts that we've seen is that this is pushing us to once again come all the way back full circle and know that we can't be siloed into just search. We need to be thinking of brand marketing in general. Brand marketing now becomes more important than ever, because the AI can gather from any source out there, not just your own site. You can do the best job in the world of presenting your brand and your services, your products, whatever, on your own site. But what also matters very heavily is what other people are saying about you, your reputation in the industry, what recommendation sites are saying, review sites, all of these things. So we have to be involved heavily in that. Overall brand marketing is more important than ever.
Great point. Mark, thank you. Victoria, thank you as well. I think this conversation lends to the point that if you think you're an expert in content, a lot of points were brought up today that I know what I just learned in the last 45 minutes. So again, I encourage anyone who found this to be insightful to shoot us a message. Let us know your insights. I also encourage everyone to please share the on-demand version of this webcast once we send that announcement through to your email. I think this really is an important message to share across the broader community. And I'd love to rediscover this same conversation in a year from now, because as I mentioned, I think that we're just at the beginning, right? So many things are just starting to evolve. So again, great insights. And I want to appreciate both of your time today. Thank you.
Yes, thank you.
Thanks. Yeah, thanks for having us. This is great.
Of course. And on behalf of Live World and Pharma Exec, we want to thank everyone for taking some time out of their day to attend today's presentation. As we do conclude today's event, I mentioned already that you'll receive the information about the on-demand version of today's program. But we also ask if everyone in the audience wouldn't mind participating in a brief survey. The survey is going to appear on your screen just after the presentation has concluded. You'll also, again, receive an email alerting you when this webcast is available for replay. It's also a great way to consider following up with our subject matter experts after today's broadcast if you have any additional questions. So thank you to everyone for joining us, and we hope to see you again soon. Have a wonderful rest of your day. Goodbye.